there. Welcome back to the Vital Stuff podcast. I'm your host, Dr. Gail Lebovic, and today I'm speaking with Dr. Dana Gordon, one of my favorite local pharmacists, who is also a very good friend. Dana is a very dedicated pharmacist. I've never really met anyone quite like Dana. He's a longtime owner of Central Avenue Pharmacy, which is in Pacific Grove, California. It's beautifully located 1 block from the beach, and he's been president, CEO of Central Avenue Pharmacy since 1991. He's one of the few remaining very strong performing independent compounding pharmacy owners in the country. He has done some incredibly innovative stuff, both in business and in taking care of patients, as well as looking into how the healthcare system can better serve us within our communities. In our conversation, we explored a lot of things, including the unique challenges that the independent pharmacies now face and how they can be essential to our health within our own community. We dive into really interesting topics like the explosion of the GLP-1 medications, the injectables for weight loss, and the growing influence of how artificial intelligence is impacting pharmacy practices. I think you're really going to enjoy this conversation with Dr. Gordon. He's a remarkable guy. He is very well respected and renowned. Everyone in the Bay Area knows him, and they know him on a national level as well. Please join me as we listen in to our conversation with Dr. Dana Gordon. Let's go back a little bit. And what, if you can remember, was there like an instance or a time or something that happened that's made you think, I'm going to be a pharmacist? Like, what inspired you to go into being, I guess, a doctor of pharmacy?
Well,
or a drug pusher, however you'd like to say that.
yeah, well, I've been called a lot of things, and some people call me, what's his name, Pablo Escobar, but the legal version of it. But, actually, other than being a young person and I remember having to deal with acne and going to my dermatologist and having to go to the pharmacy to get now that I look back, it was probably a compounded medication. I remember going to the pharmacy, it wasn't ready, but I really wasn't sure what a pharmacist did. They were the individual behind the counter that would dispense something. And I also remember half of the time it wasn't ready and I had to go back. But that was about the only vision I had of what a pharmacist was. It didn't happen until later, almost in college, which I went to college to understand business and to own a business. So it's not a story I liberally tell everybody because, most people, why do you want to be a doctor? I want to make lots of money. No, you want to be a doctor because you want to help people. I want to be a pharmacist because I want to help people. But this is the rest of the story with Dana Gordon. When I was about 17, 18 years old, I'm in Southern California, a little beach town, surf town called Seal Beach. I had a job in a wine and gourmet store. So I'm 16, 17 years old, working in this environment. And it was a wonderful experience for me. Learned a lot about wine and culture. And anyway, I ended up going to college and working at this wine store because I want to make wine a living. And I majored in chemistry and I wanted to be an enologist. And but during this time, in the wine store, this pharmacist that had a pharmacy right next door to the wine store in Seal Beach, 1 block from the ocean, he would come in and buy cases of this wine called Callaway wine from Temecula. And one day I asked him, I said, what's with all this wine you're buying? He says, well, I'm from a little town called Callaway, Nebraska, and I ship it to my family and friends. And I thought that was very interesting. So I got to know him, and I used to take my breaks and my lunches, and I'd walk next door to the old-fashioned Rexall, long and narrow. I'd go to the back of the pharmacy. I got to know this guy. I'd sit down on a little stool next to Bob, the pharmacist, and we would tell each other jokes, inappropriate jokes. And as a young man, what I saw was this man dispensing contraceptives to young women my age that were in bikinis and they were tan and we were 1 block from the ocean. And I thought to myself, I think I want to do that. I want to be a pharmacist and I want to be just like Bob. So I really got motivated in my academics, and I eventually apply and get into pharmacy school. And this whole time, I wanted to own a little pharmacy, just like Bob in beautiful, sunny Southern California, Seal Beach, 1 block from the ocean, so I could experience what he was experiencing. First, I did work for other people for years, but I finally bought my little pharmacy 1 block from the ocean in Pacific Grove. Now, this is Northern California. Monterey. Um, I can see the ocean. I'm actually closer to the ocean than Bob's pharmacy was. But I got to tell you, I don't see anybody walking into my pharmacy in a bikini. And be honest with you, it's not the kind of environment where you really want to see that. It's a completely different place. But I did achieve my goal of having my pharmacy, my independent pharmacy, 1 block from the ocean, just with a little different, I guess, reward that as a 16-year-old would have wished for back then. Yeah, it turned out Bob. Yeah, just a little anecdote. I remember the day I got accepted into pharmacy school, I went there with my letter of approval and I said, Bob, look at this. And he looks at it and he goes, that's great. With a little, not like a hug and congratulations. That's fantastic, Dana. And I said, yeah, I'm so proud of myself. And he says, he goes, you'll never make it big as you won't become wealthy as a pharmacist. He goes, it's what you do with the money that you make that will determine your wealth. It turned out that Bob owned all of the commercial properties in Seal Beach. He liked being a pharmacist and dispensing, medications to, you know, lots of people in addition to, the clientele that attracted me. Yeah, he was a great businessman. He did remember me years after. He was very big into the disability and workman's comp, and when I started compounding, he was not doing that, but he had the state contract. He approached me and asked me to provide those services for lots of people, and it really helped me from a business perspective. So I did learn a lot from him, and I wouldn't be here today if it wasn't um, for him buying all this wine and shipping to Nebraska. In any event, I achieved my goal of going to pharmacy school, becoming a pharmacist, and owning my own business, which happens to be a pharmacy. And just to give you a little bit of relevance, when I bought the pharmacy 35 years ago, there were more pharmacies than there were combined chains in the Monterey area, which is where I practice. So I remember there were close to 28 independent pharmacies, and there were less than that combined chains. In the Monterey proper, there's only 2 independent pharmacies left, my pharmacy and another one in Carmel. So the environment has changed. And so what has that done to me is I've learned to survive. And I've endured peaks and troughs in the medical healthcare system, as everybody who has practiced medicine, like yourself, Gail. It's a completely different environment. And I remember as I was enduring this, am I still going to be around from 1 year to the next? And here it is 35 years, and I'm still around. What I've also discovered is that there must be a reason why I'm still around. I think twofold. One is there's a need for pharmacists because we are the most accessible healthcare professional out there. You don't need to have to be referred to us directly. You don't even have to be a patient or a customer of ours. You can walk into most pharmacies and have a communication with a healthcare professional. So with this consolidation of healthcare, I have found that the dependency on pharmacists has grown. And personally, I find it the most purposeful time in my career is now, and that is the short version of my story of where I got started and where I am today.
Well, that's awesome. I mean, I love hearing you thrive in an environment that I know is really challenging. I've been to your pharmacy many times. It's amazing. And I think the independent pharmacist is a very special breed. I think I agree with your statement that you're the most accessible healthcare professional. You don't need an appointment either, right? People just walk in off the street, whether they're visiting Pacific Grove or they live here. I think you also know your patients or customers, whatever you'd like to call them, you know them really well. You know them personally. When Mr. Smith walks in, you know what his struggles are, what his health concerns are. Um, and it's a very different flavor than the chain pharmacy stores. Now, you've already kind of gotten into the changing environment. We know that I think there's something like 18,000 independent pharmacies in the US, and thousands of them have closed over the last several years. Um,
Relatively recently,
mhm.
it seems like it's increased more so in the last probably 3 to 5 years post pandemic, and a lot of that has to do is with the vertical integration with insurance companies, payers. Um, so yeah, that's correct.
Yeah. But the ones that are surviving, like you, are entrepreneurs.
Yeah.
And you have to get creative, which you have done. I mean, you have a lot of really interesting things going on in your pharmacy.
You also have to have the ambition, the drive, and the passion to want to do it. So, for example, even when I was in pharmacy school, I remember then express, what do you want to practice? What's your setting? A lot of people wanted to go on and do residencies and work in clinical rotations. People wanted to go to work for pharma. People wanted to work in chains. Now, I don't remember very many people wanted to own their own business. And it's not just in pharmacy. It's rather endemic, and a lot of people don't want the responsibility of owning their own business. There's increase in regulations and competition, what all the challenges that I think have existed for many, many, many years. It's just what's changed. I don't know if the workforce is uh, geared to owning a business. And I still think there's plenty of opportunity out there. Exhibit A, me. I think it's a wonderful profession. I think there's, a good living to be made, but I don't see, just like physicians, a lot of physicians are joining system healthcares, and
Mhm.
or the ones that do want to practice, are becoming these concierge doctors, right? And they're doing well, and it's not for everybody, but it's how you navigate through a way of practicing your profession in a manner that's economically feasible and professionally rewarding. One more thing I wanted to add. I was talking about, just being a pharmacist, and we're talking about our access and communications with patients. But the other thing that I find wonderful is my communication with physicians. And my rapport with physicians has increased tremendously over the years because I'm accessible to you, Dr. Lebovic, and your peers. And there's nothing as a pharmacist that gives me greater pleasure than having a doctor ask me my opinion. Because in the old days, they didn't necessarily want my opinion. They stereotypically had to have control over the medical environment. But now they understand the team approach. They also understand their vulnerabilities. They also understand the complexities of pharmacology and toxicology. And you got to pick your battles. You can't know everything. So you got to utilize your team members. And we're one of them. And in my particular situation, a lot of them have my cell number. They don't have to go through a switchboard, a voicemail, a call center, and vice versa. So that's equally rewarding for me and keeps me driven as being a pharmacist.
Well, I love that because I never really thought about that, but it's true. As Big Pharma has expanded its role in modern medicine, it's gotten very complicated. And understanding the nuances between different medications is beyond the scope of any physician, really. And you
Mm-hmm.
do need a pharmacist. And I personally know how incredibly knowledgeable you are about so many areas of medicine. It's incredible. What the business aspect of what you've done is also really um, admirable. First of all, you started by buying the building that your pharmacy's in, which is smart. I don't know when you bought it, but you bought it, and that was a really smart thing to do so that you're not just paying rent, you're actually building equity in a building. I know you treat your staff really well, and they are all incredibly knowledgeable and helpful. Um, so yeah, you're not just a pharmacist, you're out of the box, you're an entrepreneur, you're a businessman. And making all of that work, I think more than anything else, I admire you because you of all the professionals I know, you have a very balanced life. And I can't figure out how to do that. But somehow you do it, and you do it really well. You have time for golfing or biking and traveling, and I think it's a really important piece that not many people know how to manage.
Well,
Um,
I remember when I bought the pharmacy, I worked here for almost a year just by myself. So we have like 7 pharmacists and 25 ancillary staff and delivery drivers and all kinds of employees. But I remember when I first bought it, it was just me, right? And it was a 7 day a week job. And I remember getting here at 6 in the morning and working sometimes till 2 or 3 in the morning. And I loved it. I was younger. I loved it. I don't know I couldn't do it today, but I did it back then. And it was a wonderful time. The buying the building. So in any business in this day and age, you have to control your costs, and the rent for most businesses, is a significant fixed expense. And so yeah, I was fortunate to take advantage of that. Um, Along with other things, we have automation, robotics, and we still have people. People are very important, but we utilize technology in a multitude of ways to control our costs, to continue to be competitive in this workspace.
I'm glad you brought up automation because I've seen your little pill machine, which is really interesting. But
Right.
I wonder about AI. Talk to me about how that's going to impact the physician patient relationship, the physician pharmacist relationship, and all of that. Like, do you know, does it scare you at all? Or are you embracing AI? What the hell? Tell me about how
Yeah,
it's going to impact your practice,
yeah. When I turn on the news and I listen to the talking heads
which I
from both
try not to
sides.
do.
Yes, but I got to get my information from somewhere, and whether I turn it on or I read it, right? And you listen to both sides of the um, AI aisle. You're I can see the benefits of both, and how it's almost, I want to go learn it, right? Go take a course, a master class on AI, so I can understand it and use it and all that stuff. It's like CryptoCoin or Bitcoin. I never got it, never used it, still have no desire. That's not tangible. This kind of falls in that same category because I'm not sure what to make of it. But what I do know is I'm using it, and I don't even know I'm using it. If you're looking up something, hey Siri or whoever, your
Sure.
talking phone is, you can see the AI working, whereas before you had to be rather specific about looking for something. So, the other part is so I know I'm using it uh, when I don't know I'm using it, and the only thing I need to do is I need to validate that information that was just presented to me. But I do believe AI is going to have much more beneficial applications in healthcare than it will in other aspects, at least in the short term.
Give me
Because,
an example.
radiology, you
Okay, we've
know,
been actually in breast. We've used a form of AI, I would say, for many years to help read digital mammograms and things like that. But it doesn't do the final diagnosis, right? So it will help with
no,
screening,
but
large
but
numbers of screening.
yeah, yeah, and disease. discovery,
Yeah.
so and it, instead of going through we used to go through books, right? And then we went to a computer, and now you put it into the web or into the chat GPT thing, and it comes back with a lot of information. Um, so I know that I believe it's going to be helpful there a lot. The more information, the better. But how we utilize that information and the discretionary interpretation of that literature is where I don't think we as humans are going to be removed. We're going to have to navigate this machine to the best practice application for solving patients' conditions. So, I guess if I was an accountant, maybe I might be threatened. If I was an appraiser, maybe. I mean, I'm just picking these off my head. Where what they do is they plug in information, and it's a formula, and computers can do formulas. Spreadsheets probably replaced a lot of, Excel replaced a lot of manual input and stuff like that, and calculations. And I think that's what will happen here,
But
at least as it applies
I've
to medicine.
seen the erosion in medicine of using algorithms to treat patients. Okay, for example, here's a great example: a patient who might need blood. Okay, so in the old days, we had kind of guidelines. We knew, okay, if your hematocrit is at a certain level or this or that, depending on the clinical situation, we might say, you know what? If we gave that patient a unit of blood, it would help increase oxygen carrying capacity. We knew how it would impact that patient clinically. And it wasn't a set number that we said go or no go in terms of transfusion. Today, that just is so different, right? If you want to give a patient blood, for example, there is a set standard of guidelines, and that's it. You cannot do it outside of that. Even if, as a clinician, you really think that that patient needs blood, it's going to be challenging for you to give that patient blood. So I am not a big one size fits all kind of person. Especially in medicine, I feel like there's so many nuances that the human brain can process without being able to necessarily understand what that is. Like looking at a person, their skin tone, there's a lot of clinical information that you get from your five senses. The way a person smell, like their breath, might be, alkalotic. No, seriously, you can smell ketones on the breath, right? So there's a lot AI can do, but I still have faith that the medical profession needs people.
Well, look, I think without a doubt it can be helpful, but to the flawed, the potential flawed nature of this technology is yet to be determined. But in pharmacy, in insurance and formulary management, right?
Mhm.
I.e., let's go to the jugular, prior authorizations that are automatically denied because a computer through its metrics
Yes.
are saying no. And they now this is where I think it's somewhat evil, in which the you know the insurance companies, the payers, I guess you could say. Actually, we're all the payers, but they've set it up to make it difficult to get a particular drug approved, even though the doctor feels it's the right thing. And
Okay, that
that's just
example,
that's like a casino. It's odds, it's statistics, and they set up the metrics to do that, knowing that a certain percentage is it's going to
yes.
be declined, and the people will go away.
And
And
that's this it's very similar to the example that I used in terms of blood transfusion, right? You may know that a certain drug is the best drug for a patient, and you cannot administer that drug because of X, Y, and Z, because AI is saying, no, no, give this drug instead. And the insurance company is saying, yeah, I'll pay for that drug, but I won't pay for the other drug.
I'm not going to blame AI, because this has been going on long before AI, in
True.
which they've and I'm going to put it on. You can call it venture capitalists, private equity, investment banking, or whoever that has bought up independent practices and
And
put it into
pharmacies and pharmacies.
pharmacies. Are, yeah, they were easy prey, but then they started going after the doctors and hospitals and anything to do with medicine they because obviously there's money to be made there, but you know they've taken the decision making capacity out of the provider, and the system creates boundaries, roadblocks for you to to implement what's best for the patient. And AI is just reinforcing it and making it easier to turn healthcare into a profit making center as opposed to a patient healing environment. That's what it's about. In the old days, you had community hospitals, and community hospitals cared for people. Yeah, they had their flaws, but now there's not really community hospitals. They may call themselves community hospitals, but they're owned by bigger entities that invest in them and package them and make them more profitable. And so it takes the human component out of it. Now, I'm still a human. I don't think I'm AI. I'm real. And the people that have that are fortunate enough to be able to choose their healthcare providers, including pharmacies. Not everybody. Look, if you're a Kaiser patient, you can't come to me. I don't care how good I am, how nice I am, how knowledgeable I am. You've got to go to Kaiser. Otherwise, you go pay for it for yourself. Now, that's another issue. He or she who pays the bills makes the decisions. So if you want the cheapest health insurance, let's say, they're going to make your medical decisions for you.
Mhm.
So if you don't take responsibility
True.
and pony up a little bit, people are willing to spend more time in line and spend more money for a pizza than they are their own antibiotic. And so if that's the mentality you're going to have, you're going to go where they want you to get that antibiotic, and it may not be what the doctor wants for you, but the system says,
This is
metrically
what you
speaking,
get.
this is what you get.
Yeah. No, I think that says it all in a nutshell. But brings me back to the point of the importance of the independent community pharmacy and pharmacist, right? I think that is the difference. So I really appreciate that you've been able to withstand the tsunami of change in the pharmacy industry, because it has been really challenging, especially the last 5 years from the outside, from what I can see. And I just think you're amazing, and I know how much you add to the community and how
Well,
much
thank you.
everybody appreciates you. Um, so I want to change gears just a little bit. Couple of things I want to get your thoughts on. One are the GLP-1s. You know, uh, these are all the rage. Obviously, I've seen, I've known so many people who have taken it who really, I would not consider perfect candidates. Obviously, it does a great job for people who really struggle, but I think it's best used in combination with behavioral modification therapy, understanding how to eat and exercise, diet and exercise. Um, and they are touted now as kind of the miracle drugs for weight loss, but some people, as with everything, abuse that kind of a drug, right? Where they just want to be thinner, never too rich or never too thin, you know, the old saying goes. But I'd love to hear your opinion, because I don't think there's a free lunch. I think there's going to be a backlash of complications, things like that. And I just would love to hear your viewpoint as a pharmacist on that whole gigantic movement. The other thing I've noticed is the drug companies have managed to be able to sell this prescription drug directly to consumers. I find that model fascinating. So if you could just fill in some color on that whole part of the industry.
Well, I think these peptide GLPs, which really there's only two companies that make them that are indicated for weight loss, and that was kind of a byproduct of it being used for type 2 diabetes. they've been around a while, and they work. Um, they but this phenomena of 10 to 25% of your body weight loss has really driven the pendulum towards all kinds of characters getting involved in um, you know implementing care for this. And what I see, so look, we don't make it, or we don't make the injectable, let's say. There were pharmacies that made the injectable, and they still are, and I don't personally think that they should. But they made it because they were on the products were on the FDA short list. So I don't think
What does that mean?
particularly well means that as a compounding pharmacist is what I am. We make a lot of our own medications, but we're not allowed to copy what's commercially available unless there's a compelling reason. And we saw that during the pandemic because a lot of drugs were unavailable and things that I couldn't make.
Hmm.
I was allowed to as an emergency use authorization. So the FDA allows us to step in under certain circumstances, very strict guidelines, to make things. And we were, I mean, we can't even make like, I can't even make a sandwich in my pharmacy and sell it. It has to be a prescription. Okay, and I am being somewhat comical here, but that's a fact. I can't make over the counter stuff that's not even prescription. It has to be a prescription. It has to be prescribed by a doctor. There has to be medical necessity and a plethora of other factors that allow me to do it. But when it comes to branded products in particular, I can make a lot of branded products a lot cheaper, but that would take the innovation side of pharma creating a drug that takes billions of dollars. And why would they invest in it if somebody like me can come along and do it? Well, like I said, the FDA allows us to do it under certain circumstances. And in the initial height before Lilly and Novo Nordisk was able to meet the demand, they allowed us to do it. Okay,
Oh,
but that demand has now been addressed, or the supply has been addressed to the demand, and there's no shortage of any of the GLPs. But there are some companies, these social media companies that we all get inundated by hair loss and erectile dysfunction, and now it's weight loss. They're making this stuff, and I don't know how they do it. I don't know how the FDA lets this slip between their fingers, but they do, and I don't know how pharma doesn't really reinforce or enforce it. So we wouldn't have a shortage if those drugs were really just used for the real life threatening indication, which was diabetes. The problem happened when people started using it for weight loss, and the bigger problem was, like you mentioned, people that tried to lose weight that didn't need to lose weight.
mhm.
Somebody who it's but there's a zero supply issue. So, but they are remarkable drugs. We're learning more and more about them every day. Some of their promising indications, and I've firsthand seen it be beneficial with drug addiction, inflammatory conditions, um, actually, people that have chronic diarrhea. And we're going to
Wow.
see more and more indications. So here's an example. We were talking the other day about an antidepressant called trazodone. Desoril's the brand name. That's an antidepressant. It's been around for a long time, and they use it. It's commercially available for weight loss, and it's in a branded form, often in combination with another drug. But weight loss, tobacco, uh,
Wow.
yeah. So, this, and so the good news is there's other indications, and, this goes back to what does the doctor feel is best and appropriate. Look, most drugs have been, like their patents have been extended because of the side effects of the drug. And so they got a use patent on the same thing. Here's an example, Lonitin, antihypertensive for blood pressure, had a side effect, hirsutism, hair growth on parts of the body that you didn't necessarily want it. somebody said, why don't we put that antihypertensive pill, grind it up and put it into a delivery vehicle and put it where we want the hair to grow. So, and they called that Rogaine. And so that
Interesting.
happens, and that's what's happening with the GOP. But what will also happen is there'll be more competition, and that increases, cost reduction, and it being more available to those that can't afford it. Because right now, unless you have, you know, interesting insurance. When I say interesting, I don't see a lot of insurances covering it for weight loss. And I see them pushing back on it for even type 2 diabetes because they want the doctors and the patients to try the inexpensive generic drugs first. And quite often they work. They do work. Why do you need to go to a diamond when,
What makes
when the
it so expensive?
why again, I think it's the develop, the cost of the billions of dollars it takes to develop the drug.
Oh,
And you got to remember, and you've been involved in FDA studies and trials to get it through. And you got phase 1, 2, 3. I don't even know how many there are, and it takes years. And I think most of them don't come to fruition. So a lot of money has been invested by private investors and pharma and academia to develop new drugs, and most of them don't come to fruition.
mhm.
So, but when one does, they're going to protect their intellectual property and run that horse as long as they can. And I don't blame them. Um, but what I don't agree with is why we're more expensive than other countries. And to the degree of difference in cost. And that tells me that we are subsidizing other
Oh.
uh,
Is that the
healthcare systems.
case? Is that the case? The same drug?
Absolutely.
Oh, give us an example.
Of how a drug
The
is more
cost
expensive
difference.
here.
Yeah.
Oh, from what I heard, these GLPs where they're 1,000 plus, you can get for $100 in Europe. Now,
Same
I haven't looked
medication?
at it. The same medication, the same brand.
Wow.
Yeah. Now maybe it's maybe it's $200 or $300, but not $1,200. That's a big difference.
Yeah. That doesn't
And
make
we all know
sense.
we're all familiar with Canadian pharmacies, right? And people often go over but the problem with all that is if you buy your medication outside of the US FDA's jurisdiction, then if something happens, what are your, repercussions? Who are you going to go after? Who are you going to sue? So, it's a risk versus benefit thing, but regardless, you know, that bipolar economy and pharma exists in this country. I always said if you want a cheap brain surgery, you can go. There's lots of third world countries that you can probably get it for $3,000 or $4,000 or less instead of $350,000 in this country.
Wow. I had no idea that was the case, that the same medications are more expensive here than where they're manufactured.
I
Just
would
doesn't
say
make sense.
it's 100% of the time more expensive here, unless it's something that's approved in another country and not
Wow.
approved here. But then you shouldn't be buying it, right?
Yeah. Yeah. Wow. That's really interesting. You see, I think at the crux of all of this, you really are a businessman. You really are.
We all are.
And you're an entrepreneur. And I know that because we met over my latest company, which I created this new product, which is like a toothbrush for your nose, as you know. And I just want to thank you for that too. Just having an open mind to embrace something that was, in a lot of people's mind, a crazy idea. And you were so welcoming. You tried it. The first thing you did was you tried it. I remember that. And then you put it right there in your pharmacy. You were the first pharmacy in the country, in the world, to actually embrace it. And I just so appreciate that enthusiasm, and all of that came on the back of just an introduction so that I could share my new invention with you. And I really appreciate it. It's been great.
Well, Gail, first of all, I had an open mind and I had an open nose. Okay, and I love it. And you know, here's another. The older I get, right? I'm going to be 65. You know, um, I'm turning into my father. Okay, you know, I remember his ailments. Um, uh, which I actually thought he was old when he was probably in his early 40s, right? So, um, but you know, the older we get and the more we are experiencing the aging process, that a lot of these compromises in our health are very private. That, you know, when I was in my, obviously my teens, 20s, maybe even in my 30s, might have been embarrassing for me to talk about, even though I'm a healthcare professional. But when it starts happening to you, and someone comes to you reluctantly because they're ashamed to have a conversation about something, um, it's very fulfilling um, to empathize, honestly empathize, and to not joke about it. I mean, I'm even talking about my close buddies, let's say, that, you know, you wouldn't talk about certain things, but, you know, they eventually approach you and you have a conversation. Now, this nose thing, um, you alluded to the fact it's not necessarily a common vernacular to talk about nasal hygiene, and how do we, you know, how do we talk about it and incorporate that into our healthcare equation of cleanliness. And it's like working out and eating properly and not overdoing anything and controlling the environment you're in. That's one of them. It's so easy. I love it. And it's I don't find it difficult at all to talk to people about it, um, and introduce them to it. It's and your this particular product um, is so unique and so eye catching that you can't help but go, "What is that? Tell me more about it." And the more you tell them, the more it makes sense. So that was an easy sell.
I love it. Thank you so much. Like I said, you're a great advocate, and I just appreciate all the time that you've spent and the knowledge that you've shared with me. I know that your patients who use CPAP also appreciate you having it there in the store. And I don't know, it just was a great way to meet you. I would
That's right.
never have met you had I not
Right.
created nasal cleanse. So here we are. And I love, more than anything, love our friendship and just appreciate you as a human
It's
being.
certainly a beautiful thing.
It is. It is a beautiful thing. Thank you so much, Dana. Did I leave anything out?
You know, this was not something I was able to rehearse. So no, this went smoothly, and you know, we've never had a loss of words and conversation with each other. So to me, this was just another Dana and Gail getting together and shooting the shooting something, shooting the
Shooting the
stuff.
stuff.
Yes.